Hey guys, in this video I'm going to cover the medical Japanese behind the respiratory rate. I'll go over some of the key medical Japanese words in kanji when it comes to measuring a respiratory rate, going over simple ways to help you better learn and understand the words and implant them in your memory. So let's get straight into it. A respiratory rate is the amount of breaths someone takes in a minute, and the word for this in Japanese is kokyusu. Breaking the word down, we first have the word kokyu, which means respiration or breathing, followed by the kanji su, which means number or rate, together making respiration number or kokyusu, which is respiratory rate. So a very literal translation there. Now I'll cover normal respiratory rate. So there are various ways to say normal respiratory rate or normal breathing, but a common way of saying normal respiratory rate specifically that most would understand is seijou na kokyusu. Breaking it down, we first have the word seijou, a very common word in both regular and medical Japanese to mean normal, followed by na, the particle to link na adjectives, and then the word kokyusu, which we just covered to mean respiratory rate, so all together making normal respiratory rate or seijou na kokyusu. And just a quick note, the normal respiratory rate for adults is 12 to 20 breaths per minute. I've got a table that lists some of the respiratory rate ranges depending on age and stage in life. Please feel free to pause if you want to take a better look. I'll now cover some of the main conditions you can encounter with respiratory rate. So when someone's breathing frequently, beyond 20 breaths per minute, it's called tachypnea, which in Japanese is hinkokyu. Breaking the word down, you first have the kanji hin, which means frequent, followed by the word kokyu, which means respiration or breaths, together making frequent respiration or hinkokyu, which is tachypnea. And when someone's taking less than 12 breaths per minute, it's called bradypnea, which in Japanese is jokokyu. Breaking the word down, we first have the kanji jo, which means slow, followed by the word kokyu for respiration or breathing, together making slow respiration or jokokyu, which is bradypnea, so another very literal translation there. I've also got a couple of other patterns of breathing you may see when measuring a respiratory rate. So we first have hyperventilation, which is rapid and deep breathing that reduces carbon dioxide levels in the blood. I've got a couple words that mean hyperventilation, so the first word for hyperventilation I'll cover is kakokyu. This is the more layperson or everyday word that you'll hear for hyperventilation. Breaking the word down, we first have the kanji ka, which means excess or excessive, followed by the word kokyu for respiration or breathing, together making excess breathing or kakokyu, which is hyperventilation. Another way of saying hyperventilation in Japanese is kakanki. Unlike kakokyu, which is the more everyday term, kakanki is the more clinical and medical term for hyperventilation. So breaking kakanki down, we first have the kanji ka, again for excessive, followed by the word kanki, which means ventilation, together making excessive ventilation or kakanki, which is hyperventilation. The opposite of hyperventilation is hypoventilation, which is the slow, shallow breathing that results in an increase in carbon dioxide in the blood. The word for hypoventilation in Japanese is te-kanki. Breaking the word down, we first have the kanji te, which means low, followed by the word kanki for ventilation, together making low ventilation or te-kanki, which is hypoventilation. The next word I'll cover is hypopnea, which is increased depth in breathing in response to increased oxygen demand, and the Japanese word for hypopnea is takokyu. Breaking it down, we first have the kanji ta, which means many, followed by the word kokyu for respiration, together making many respiration or takokyu, which is hypopnea. And the opposite of hyperpnea is hypopnea, which is shallow or reduced breathing where there's a significant decrease in airflow. The word for hypopnea in Japanese is te-kokyu. Breaking the word down, we first have the kanji te for low, followed by the word kokyu for respiration, together making low respiration or te-kokyu, which is hypopnea. I've also got some other abnormal breathing patterns that you may encounter in patients of certain condition. So the first one is chain stoking, or in Japanese is chain stoku kokyu. This breathing pattern involves alternating cycles of gradual increase and decrease in breathing depth, followed by a period of apnea or no breathing, as you can see in the waveform. You might see this type of breathing sometimes in people with heart failure or brain damage. You've also got kusmao breathing, or kusumauru kokyu, which is deep laboured breathing often seen in patients with conditions such as DKA or metabolic acidosis, where they need to blow off excess CO2 and correct acidosis. And there's also Biot's breathing, or Bio kokyu, which are groups of irregular breaths of varying depth, interrupted by sudden apnea, and is often seen in people with brainstem issues. And I've now just got some other words that you may assess when assessing someone's breathing or respiratory rate. So you may assess the breathing depth or fukasa, the rhythm, 리즈무, thoracic mobility, 胸部の可動性, posture and breath sounds, 姿勢や呼吸音. You may also see some accompanying symptoms, 随伴症状, such as difficulty breathing, 呼吸困難, wheezing, 喘鳴. And when patients have quite severe issues with their breathing or lungs, you may see cyanosis, チアノーゼ. And that's the end of the video. If you'd like more videos that break down medical Japanese to make it easier for you to learn and remember, please subscribe and check out the channel. Thank you for watching.